Hi, my name is Dr. Brad Muir. I am one of the co-developers and co-creators of the VMTX protocols that we use to try and treat various soft tissue injuries. I've also been a part of the team that's helped develop the VMTX Thumper massage unit, which we're going to show you how to use today. I'm here today with Dr. Courtney Brown, and today we're going to go through and show you how to utilize the VMTX Thumper massage unit to treat supraspinatus impingement of the shoulder. The supraspinatus is one of the rotator cuff muscles, and it's one of the most commonly impinged muscles in the shoulder that can be due to overuse injuries. So today we're going to go through and show you how to use the machine in a variety of ways to try and help you with this particular condition. One of the nice things about utilizing the VibraMax Thumper massage unit is that you can treat right over top of the clothes, and you can use it in a variety of different ways to try and enhance your treatment. So the first thing that we're going to go through and do is show you how to utilize the machine just as a more of a trigger point type of a treatment, where you can place the unit right over top of the muscle and have the patient just sit for a second, and then we can also utilize motion in that to try and show you how to treat that supraspinatus and then some of the other muscles. So the first one that we'll do is we come in, we'll try and find the spine of the scapula. We're going to come in, place the unit right over top, and I can just sit with the unit on and let that muscle try and relax underneath the vibration that's going into the musculature and through into the fascia. So I can treat through there. Then I can try and move the machine along the muscle belly itself to try and get some relaxation with that. And then the third thing that we can go through and do is have the patient try and move through a bit of a range of motion to try and enhance and increase the amount of range of motion about that joint and treating the muscle at the same time. So in order to try and treat this muscle, I'm going to have Dr. Brown take her arm from this position and drop it into her back pocket. Good. And then coming back up through again and dropping back down. Good. As we know, with a lot of different overuse type syndromes, the muscle that tends to be the victim in the whole part of the problem isn't always the one that's causing some of the problem. So I'm going to show you how to try and treat some of those other muscles as well. So one of those muscles that might be involved is the infraspinatus. So again, finding the spine of the scapula coming down just inferior to that. And again, I can go through and just place the unit on top and try and work through the muscle. This acts not only to try and get some relaxation, but also to warm the muscle up a little bit. And then if we want to add a little bit of motion to that, I'm going to have Dr. Brown bring her arm up, and I'm going to have her take her thumb to her opposite knee and try and roll through, and I can just work the massage unit right along the muscle belly itself. Good. And coming back across. Excellent. And across one more time. Good. Now, when we're in this position, using basically the same motion, we can also treat the teres minor muscle, which goes just underneath that. And working through and back up. So if you notice with the massage unit, when we're working through the range of motion, I can utilize it in both directions. So as she returns to a neutral position, the starting position, I can work the massage unit back across again. And as she goes down, I can work it across the muscle belly. One of the other aspects of treating a supraspinatus impingement is to try and get good scapular placement. So we're going to try and activate some of the scapular stabilization muscles. A couple of those muscles that we're going to be activating is the rhomboids, which is between the medial border of the scapula over towards the spine, and basically is going to retract the shoulders. So one thing that I can come in and do is try and activate those muscles a little bit just by rubbing the unit over top. And then as Dr. Brown brings her arms up into a position to try and pencil pinch, I can try and activate that muscle throughout there. Another muscle that's involved in good scapular stabilization is the lower trap muscle, which comes off and attaches down into the lower thoracic spine. And that muscle runs in. I can also come in and activate that a little bit. So we'll try and warm that muscle up a bit. activate it, and then I'll have Dr. Brown go into the pencil pinch motion again, and this time I'm going to have her drop her elbows into her back pocket. And by doing so, you're going to help facilitate good scapular stabilization so that when you're looking at rehabbing this type of injury, you can also use the massage unit to try and help with rehab. Good. Then I'm going to get Dr. Brown to go onto her back for me. So one of the other couple of muscles that we need to try and go in and treat with any kind of supraspinatus impingement is looking at the muscles that are going to create a bit of compression on the shoulder joint itself, and also limit how much overhead motion you can get in your shoulder. Those muscles are going to be your lat teres through the latissimus dorsi and the teres major, and then between the border of those two muscles as well. So one of the things that we can do utilizing the machine, because you do happen to have a free hand, you can come in, you can support the arm and work it through the range of motion in more of a passive action, trying to take it up if the patient feels any sort of impingement and getting any pain on the anterior part of the shoulder. We can go through and stop it at any point, and we can just work through the rest of the range utilizing that machine. Again, if you notice as I go through, I'm working it one direction, but then with the machine I can also work the muscle in the opposite direction. Coming back through, trying to treat that and help to increase the range of motion around that shoulder. Okay, another muscle that we can go in and treat is another one of the rotator cuff muscles, which is your subscapularis muscle. The subscap muscle is quite deep in the axilla, so by going into the armpit and trying to treat in, I can press quite deeply in with my thumb. One of the nice things about this unit again is that I can place the machine onto my hand and use my thumb to try and work the muscle in the way that I want to try and see some benefit for that patient. So I can come in and press, I'll have the patient activate in an internal rotation motion, and I'll feel that subscap muscle push into my thumb. Then I can have her just relax through there, and I can come in and try and treat that muscle by using the massager on my hand. One of the things with utilizing it in this manner is you want to make sure that you try and keep it not on the bony parts of the tissue, but in through the more meaty aspects, and let that vibration transmit through your thumb into the tissue that you're trying to have the effect on. So go through here and try and treat that. And then from there I can have the patient try and raise the arm up a little bit over top of her head into a slightly different position. So I can treat it through a variety of ranges and see where it might start to get stuck, or if the supraspinatus muscle gets impinged, and just stopping and working it back through the range. One of the other muscles that can have or two of the other muscles actually that can have an impact on the supraspinatus muscle is the pec major and also the pec minor muscles. So when these muscles tend to get tight, it makes it very difficult to try and keep your shoulders back in a good posture position and a good scapular stabilization position. So once we can utilize the VMTX Thumper massage unit to try and relax out the pec major muscle as well as the pec minor. So in coming in across, we can work across the fibers, and I can also control the patient's arm in a downward motion, trying to get that pec major across in more of the muscle belly area. And then I can work it all the way from the insertion point across into the muscle belly. So work it down into the arm. Good. Now the pec minor muscle is a very small muscle which falls just and attaches onto the coracoid process, which is just underneath the collarbone or the clavicle of this patient. So I can come in, I can try and palpate and see where it's tight. Now, there isn't a lot of motion involved with that muscle, but I can come in and use the machine as more, again, of a trigger point type of a treatment. I can place it on top of that muscle and let the massage unit sort of sink into the tissue until I can feel it relax. You can add another motion with it. Usually I'll come in and try and raise that arm up overhead and try and just maintain the contact across that pec minor. So by relaxing those muscles off again, and then coming in and doing your pencil pinch to try and help with your scapular stabilization, you can start to facilitate the rehab part of the protocol in terms of trying to get that supraspinatus impingement condition better.